Last year, we did a story about the amazing work one area group did for a man that had suffered from several strokes. Today, we're joined again by the staff of Piedmont Regional Feeding and Oral Motor Clinic to see the life-changing work they've accomplished for a little girl with Down syndrome. Executive Director Amy Boone tells us more.
PRFC is a speech and occupational therapy clinic. We serve from birth throughout adulthood, and we help with all kinds of things, and we love our patients.
And speaking of loving them, Arwen is here. Tell me a little bit about her, and she's such a sweetheart.
Arwen is definitely one of our very special patients. I've personally been working with her since she was about 2 months old, 2 or 3 months old, and we just join in her success, and we get so excited for her.
And I want to have a chance to talk to Mom a little bit about the journey you've had with Arwen, because you've worked very hard and you've needed a lot of help, haven't you?
Yes, Arwen was in the hospital for 4 months when she was born because she has a heart defect and Down syndrome, and we've had a lot of therapists here at PRFC that have really made a big difference in her life and have supported our family along this journey.
Let's go into a little more detail, because you didn't have a lot of resources when she was young, and how has PRFC helped you?
PRFC has allowed Arwen to go from being completely tube fed to being able to feed herself purees. She's able to walk and write, and she's gone from using mostly sign to being able to communicate in sentences. So it's just made a huge impact on her life and on our family.
And this is so much in this world to think about. This is you taking care of her 24/7. Talk about a little bit about her learning that sign language, because she's just, 6-7 years old, and she knows over 500 words.
Yes. So it took a lot of work. Amy T came in a lot, and she taught me a lot of sign, and so then we worked with her, and so it was hours and hours of, showing her signs and teaching them to her, but also Amy helped us teach her how to incorporate them into her daily life as well. So they would be things that were important to her. And so it gave her an opportunity to communicate with us that would not have been there until probably a year or two ago if she had not learned sign.
Wow. And as a parent, I know there's so much anxiety. You want to help your child, and you can feel so helpless if you don't know what they want. That must have been so much of a difference when that started coming together to understand what she really needed.
Yes. It's hard not knowing when she's in pain, when she was upset, things that she wanted. So it just really made a big difference for her to be able to talk to us about those things.
And I have the speech therapist over here, and I want to talk a little bit about that. It's amazing. She's talking now. What has that journey been like?
It has been wonderful. When I first started working with Arwen, she still mainly used sign language. Now she will come in and say, "Hello, Miss Lori." She used to use the sign for L like this, to say my name, and now she comes in and she's, speaking in short sentences. So it's been wonderful.
And as an occupational therapist, what have you guys been doing?
We have been working on a lot of fine motor, eye-hand coordination, some sensory processing. I've had Arwen for about a year and a half, and she has really risen to the challenge. It was really hard for her to bring both hands together to string beads, to stack blocks, hold a crayon, and now she's actually imitating lines, draws a circle across. She can write A independently. She's just come a long way.
And Mom, in general, too, did you ever think you'd be to the point where your child would be reading, possibly writing, all of these things? This is amazing.
We weren't sure. Actually, when she was born, we weren't even sure if how long she would survive. If she was going to live. So to go from that to being able to begin to read and write, it's amazing.
That is amazing. And Amy, you've done so much for this family, and you do a lot for the community at large. You have other services as well. Tell us a little bit about that.
Well, with our speech therapy, we do feeding therapy, and we also do traditional speech therapy. We have augmentative communication devices. We do articulation therapy. We do a lot with the oral motor development of the mouth muscles to get them stronger, and then adults if you've had a stroke or Parkinson's and those type of things. So with our occupational therapy team, we have an amazing team. They do a lot of sensory things for children with autism, and we just have a great team here. I'm really proud of all of them.
And let's see if we can get Arwen to say something. Arwen! Come here, sweetheart. Hi. I am good. Let's stand over there. Do you love everybody here? Do you like Lori?
Yes.
Mm-hmm. And if you'd like to learn more about PRFC's services, give them a call, 434-799-7732. Also online at prfeedingclinic.com, and you can find them on Facebook.